welcome you to our third in the series of Science in the Bible. Before we start this evening, we would like to make a disclaimer. For this particular lesson, due to the sensitive nature of the material, we do not suggest that this lesson be listened to by preteens or children. God's Word does address all areas of our life, but as teachers, we have to be sensitive to the level of maturity and understanding of our audiences. So we'd appreciate it if you would recognize that. Anyway, so this is our third lesson in the series of Science in the Bible. I've had several people ask me where they could access the previous lessons. If you go to YouTube and then for the channel, look for the Ray of Hope Church, Comanche, Oklahoma channel, you'll see these lessons as well as many other great Bible teaching lessons. So tonight, as we look at our lives, we're certainly blessed to live in an age and a country where we get the benefit from the discoveries of modern science. As we studied in the last two lessons, since the late 1800s, medical science in particular has just blossomed and come up with so many new discoveries. The one we studied in our first lesson was the germ theory of disease, how we now understand about infectious diseases based on microorganisms, things we cannot see. And as we've studied in the last two lessons, we've seen how modern science has proven the why of a lot of God's teachings in the Old Testament about how He told the Israelites to keep healthy. You know, they had no understanding of why He told them certain things, but now modern science has proven so much of why God said those things, and God was 100% correct based on what we've proven with modern science. So back in the first lesson, just a very quick review. The first lesson, we looked at what we're all doing with this COVID-19, the quarantine, the social isolation, the hand washing, the mask wearing. All of these things were actually instructed by God to the Israelites in Leviticus and Numbers to help prevent the spread of contagious disease. Now, they didn't understand why, but today we do understand why because of modern science has proven the germ theory of disease. In the last lesson, we looked at some of God's dietary instructions to the Israelites, how they were not to eat animal fat, they were not to eat the meat of animals found dead, and also He instructed them on not living in houses with mold infestation. Well, again, they didn't understand the why, but today, because of modern science, we understand that all of His instructions were entirely 100% accurate and correct. Something I haven't said the last 2 weeks that I should say is that there are no other ancient writings besides the Bible that are scientifically correct. In the first lesson, we looked at some of the science from Egypt from 3,500 years ago and how absolutely incorrect that was. And so we're thankful that we have the Bible to study, and we see how through modern science, God has been proven to be 100% correct in what He taught the Israelites thousands of years ago. Now tonight, we're going to take a very interesting look at the ancient rite of circumcision. We're going to look at the medical ramifications of circumcision. Now, it was first mentioned in Genesis 17, verse 10 and 11. Now, God is speaking to Abraham. This is approximately 600 years before God spoke to Moses and gave him the instructions that we've talked about in the last two lessons. So let's read Genesis 17, verses 10 through 11. This is the covenant that you and your descendants must keep. Each male among you must be circumcised. You must cut off the flesh of your foreskin as a sign of the covenant between me and you. Now, as God is speaking to Abraham, He is speaking of physical circumcision as a sign of a spiritual covenant, and we understand that. And He's telling Abraham, I will have this with you and all of your generations to follow. Now, what we know is that Abram was the father of Isaac, and through Isaac we have the lineage of the Jewish people. And so down to today, now 4,000 years later, 98% of Jewish men are circumcised. Now we also know that Abram had another son. Through the handmaiden of his wife Sarah, named Hagar, he had a son named Ishmael. And Ishmael and his descendants are the Muslim people. So Abram circumcised Ishmael because he was part of his household. And today, 98% of all Muslim men are circumcised. So remember these facts as we go through this lesson. You'll see how they bring light to us. Now today, certainly we are under the New Covenant. We're under the New Testament. And there is no requirement under the New Testament by God for Christians to be physically circumcised. Rather, the writers of the New Testament speak of our circumcision as a circumcision of the heart. So physical circumcision today is a choice of parents. But tonight, what I want to do is to look at the historical, medical aspects of physical circumcision and see how that actually impacted health. I think you'll be amazed at the scientific basis of what God told Abram 4,000 years ago. Now, first let's look at the word circumcision. It comes from two words, circum and cision. Circum means around. So we get, think of the word circumference, means the distance around something. So circum means around, and then size, C-I-S-E, means to cut. So we get the words incision, excision. They contain the word size. So when a doctor is going to make a cut into the body to do surgery, that's an incision. He's cutting in. When a doctor looks at your skin and says, you have a skin cancer, I want to cut that out, that's an excision, cut out. So the word size means to cut. So circumcision means to cut around. So circumcision is certainly removing the foreskin or the male genital organs. So in Genesis 17, God is commanding Abram that himself and all the males that are his descendants should be physically circumcised. And then he says something very interesting. Let's look at the next verse. He tells Abram when to circumcise baby boys. Let's look at Genesis 17, verse 12. From generation to generation, every male child must be circumcised on the 8th day after his birth. On the 8th day after his birth. So he's telling Abram, if you have a baby boy that's born in your descendants, that boy needs to be circumcised physically on the 8th day of life. Now, again, the Jews, the Israelites, had no clue why God told them that. They simply had to believe and obey by faith. But what I want to show you tonight, let's look at the modern science behind what God told Abram on when to do the physical circumcision. Again, God's instructions were 4,000 years ago. Now let's look at modern science starting with the 1930s. Scientists discovered a blood clotting factor called prothrombin. In medical terminology, a thrombus is a clot. So prothrombin was named because this chemical in the body promotes clot formation. So it's a blood clotting factor, as we call it. And so in the 1930s, it was discovered that we have to have prothrombin in our blood to promote blood clotting. Then also in the 1930s, a scientist named Dr. Armand Quick developed a prothrombin blood test to determine a patient's level of prothrombin to see how well he could clot his blood. And even today in our clinics, we run this prothrombin test. We call it a ProTime. Even today in my clinic, I had a gentleman come in to get his ProTime test. A lot of patients today get ProTime tests for two reasons. Sometimes it's done as a preoperative lab work because obviously a surgeon wants to know that a patient can clot his blood if he's going to have surgery. So often it's a pre-op lab work. but also patients that take the blood thinner called Coumadin or warfarin get pro-time blood tests, usually monthly, to be sure that their dose of blood thinner is correct, that they can still clot their blood to some degree. And then later in history, in modern science history, in the 1940s, modern science determined when and how prothrombin was developed in newborn infants. So for centuries, there's been a problem with newborns. It's called neonatal hemorrhage. So a fairly frequent cause of death in newborns prior to the 1940s and 50s was called neonatal hemorrhage. So between days, especially days 2 and 5, a child would have a hemorrhagic event which could cause disability or death. And so in the 1940s, modern science discovered that after birth, a baby's prothrombin level does not reach normal levels until day 8. Did you hear that? Modern science discovered in the 1940s that a newborn's prothrombin level does not reach normal levels until day 8. Modern science discovered that in the 1940s. God knew that 4,000 years ago. So a question obviously we ask is, well, in the last 20, 30, 40 years, we've circumcised babies 1 or 2 days after birth. How do we get to do that? Well, as a sidebar, let's just talk about that for just a second, because certainly that is a question that comes to our mind. In the 1930s, a Danish scientist discovered what we call vitamin K. The German word for coagulation begins with K, coagulation with a K. We spell it with a C. So he called the vitamin that helps coagulation and helps promote prothrombin as vitamin K. And then he actually received the Nobel Prize in Medicine in 1943 for developing the relationship between vitamin K and prothrombin and helping blood clotting. So by 1961, there was enough scientific evidence that the American Academy of Pediatrics recommended to all doctors that all newborns receive a vitamin K injection in the delivery room. So we've been doing that now for almost 60 years, and so that rapidly increases the prothrombin level in the baby's blood and allows us 2 things. Number 1, to do circumcisions within a day or 2, and then number 2, it prevents this neonatal hemorrhage complication that some babies have. And so that's how we get past waiting the 8 days that God prescribed 4,000 years ago. But the fact remains, without the vitamin K injection, we would not be able to do circumcisions until day 8, just as God instructed 4,000 years ago. So we talked about the cuts, which is the circumcision. We've talked about the clots. Now let's talk about the cancer and see how that plays into this whole situation. Now, when you say the word cancer, it's a lot of different diseases that fall under one umbrella. It's kind of like infection. The word infection is a lot of different diseases that fall under one umbrella. The cancer I want to talk about tonight is called cervical cancer. Cervical cancer. The cervical cancer is the cancer of the opening of the womb or the opening of the uterus. This is why women get pap smears, because in turning from normal cells to cancer cells, there's a transitional phase that takes months or years, as all cancers do. We don't have normal cells turning into cancer cells overnight. There's a transitional phase. And so the purpose of a pap smear is to keep up and test the cervical cells to see if there's any of these transitional stages or precancerous or cancerous cells present. So cervical cancer has been found to be a unique cancer in that it has now been scientifically proven to be due to a viral infection. So it's a result of an infectious disease. After years and years of research, in 1999, cervical cancer was declared to be absolutely caused by the virus called human papillomavirus, HPV. And there's many different strains of that, just as like, say, the flu illness. There's many strains of all viruses. But there are some high-risk strains of HPV that we now know are the cause of cervical cancer. So cervical cancer is considered to be a sexually transmitted disease. Now, this is why we have developed, modern medicine has developed HPV vaccines. And so one of the brands that we use in our clinic is called Gardasil. And so this vaccine is available to older children, teens, and young adults to try to prevent the cause of cervical cancer, which is to prevent HPV infection. Now, with this history, we have to ask ourselves, what was it? You know, cervical cancer is a cancer. Like many other cancers, it's a terrible, terrible disease. What was it that made doctors start asking themselves, is this something that's infectious? Is this something that's transmissible? What is causing this tremendous amount of cancer? Because now that we have a treatment for cervical cancer and Pap smears, we know the cause, the incidence of cervical cancer has greatly gone down, but for hundreds and hundreds of years, cervical cancer was by far the greatest cancer in numbers in women. The greatest incidence of cancer in women was cervical cancer. Well, the first observation about cervical cancer being possibly something that was transmitted or infectious or contagious was in the early 1900s. A doctor named Dr. Hiram Weinberg, who worked at the New York Mount Sinai Hospital. Mount Sinai Hospital was a huge hospital with a huge clientele. Many Jews were the clientele, but as also many non-Jews. And he was doing this record review of all the cancers they had treated, and specifically of cervical cancer, because it was the most common female cancer. So he came across a very interesting statistic. When he looked at the cases of cervical cancer, he noticed that in non-Jewish women, cervical cancer was extremely common, but in Jewish women, it was extremely rare. Now, he couldn't explain why, but he made this observation and published this observation. And so cervical cancer was killing women, but it was almost exclusively non-Jewish women. Anyway, so this remained a mystery, and then about 5 decades later, we started seeing more reviews like this. In 1947, in the American Journal of Rentgenology, that's another word for radiology, Dr. Ira Kaplan reported his review of cases of cervical cancer from the New York Bellevue Hospital, another huge hospital in New York City. And he noticed that in spite of the large number of cervical cancer cases, that there were hardly any among the Jewish women who frequented his hospital. 2 years later, in the Journal of the American Medical Association, gynecologists at the Mayo Clinic did a review of all the cervical cancer cases that had come to their clinic in recent years. They counted 568 cases of cervical cancer in women, and they found not a single case was in a Jewish woman. This is in spite of a significant number of their patients being Jewish. 5 years later, in the New England Journal of Medicine, there was a study of cervical cancer cases in Boston at Mass General, the huge hospital, huge teaching hospital associated with Harvard Medical School in Boston. And again, cervical cancer was found to be 8.5 times more frequent in non-Jewish women than in Jewish women. Subsequent research in Uganda and India among the mixed population of Muslims and non-Muslims found exactly the same thing. Remember from our history, Muslims are descendants of Abraham through Ishmael, and they practice physical circumcision too. And so in these studies in India and Uganda, they found the same thing that these researchers in America have found, that in the non-Muslim population, there was a tremendous amount more cervical cancer than in the Muslim population, where the males were circumcised. And so all of this research led modern medicine researchers to the idea that there was an infectious disease causing cervical cancer, and that eventually led to HPV, human papillomavirus, as being the cause of cervical cancer. And so men who were circumcised had a lot less chance of passing that on. Now, nowadays, in 2020, we have much better hygiene. We have pap smears to catch cervical cancer in early stages before it becomes cancer, and we can now catch it in the precancerous stages. We have HPV vaccine. So actually, cervical cancer cases have plummeted. So obviously, physical circumcision is not nearly as important as it used to be in cervical cancer prevention. And as I mentioned earlier, as Christians, we live under a new covenant, so that is not a requirement of God because our circumcision is of the heart. But as in the last two lessons, I've shown you that God cares about our physical health as well as our spiritual health. Remember the verse that I quoted the last two lessons out of Exodus 15, verse 26, where God made an incredible promise to his people as they left Egypt that if they would keep his commandments, he would give them instructions to help keep them healthy. Let's read that promise in Exodus 15:26. He said, "If you will listen carefully to the voice of the Lord your God and do what is right in his sight, obeying his commands and keeping all his decrees, then I will not make you suffer any of the diseases I sent on the Egyptians, for I am the Lord who heals you." And the Lord who heals you is where we get Jehovah Jireh. And so this promise that we just read was given to his people by God 3,500 years ago. Tonight, what we've studied about circumcision was given by God 600 years before this promise in Exodus. And so what we've learned tonight is that physical circumcision, as described to Abraham, had not only a spiritual significance, but also it showed us, number one, that God knew all about prothrombin, and that newborns had a normal level of prothrombin only after age 8 days of life, and so circumcision could not be carried out before then because of the risk of bleeding. And also that God was well aware that physical circumcision would help prevent cervical cancer. So once more, we have the same three conclusions. We have to conclude from this that God is all-knowing. He is omniscient. Modern science is gradually discovering the mysteries of the universe that God has created, but God knows all these things that modern science is discovering because he created the world and the universe. Number two, God cares about you and me. His word gives us instructions about how life is best lived, not just physically, but emotionally, mentally, and spiritually. And the third conclusion is, just like Abraham 4,000 years ago didn't understand why God told him about the physical circumcision, but he did it by faith. He walked by faith and not by sight. Today, there's instructions in God's word that may not make human sense to us, but we need to trust in God. We need to walk by faith and not by sight. So, as I've said before, I'm very thankful for modern medical science. I use it every day in my clinic, but my trust is in the Lord. My hope is in the Lord. My faith is in the Lord. So thank you for joining us tonight. We'll be back in 2 weeks with more science in the Bible. Thank you.